I am Dr. Arun, working at Palaghat Quality Clinic as a consultant physician. I am talking to you today a little bit about COVID-19, the pandemic that is gripping the world. We know all of the world, most of the world is now in a lockdown situation. Everybody has stopped doing everything what we usually do. There's no cinemas, there's no music programs, no cricket, no IPL, no Champions League like that. All because of this pandemic produced by a coronavirus called SARS-CoV-2. So I will briefly update you about what is this and what you have to do to avoid getting an infection, what you have to do to avoid giving that infection to somebody near you. So this is a virus, it's an RNA virus. It usually spread through droplets. Droplets means when you speak, you may, some droplets may come out of you. When you sneeze or cough also, some droplets may come out of you. That can go up to say about 6 feet or 2 meters in the air and land up on somebody else's face or somebody else's hand or some place around like that. And that's this, if somebody can directly inhale it through their nose or mouth, then they can get the virus. Or if it was in somebody's hand, fell on somebody's hand, and the hand goes to the mouth or nose, again that person will get infected. So it's a droplet spread mainly. So that's how this coronavirus is spread. So what will happen when the virus enters your body? Usually there is an incubation period of around usually an average of 6 days to a maximum of 14 days. So you will get an illness, very mild illness in some people. Some people will not have any illness, but in a small majority, around a small percentage, around 20% only, will have a little bit of severe illness, which needs hospitalization. And around 5% may need an ICU admission. And of which very few, maybe around 2 or 3% or less than that, may die also due to this illness. So this can produce severe cough, breathlessness, fever of course, running nose a little bit. Rarely it can produce loose motions, severe body pain, etc. like that. So this illness actually do not have any specific treatment now. You can give only supportive treatment. That is, you give paracetamol for fever, there is cough, you can give something for cough medicine. When patient becomes breathless, when the oxygen saturation in the blood falls, then he or she may need an oxygen support. If the oxygen support is not enough to raise the oxygen saturation, he may need some mechanical ventilation. And we also give some medicines for supporting all this, but none of these medicines do not kill the virus as far as we know now. So we have only supportive therapy. So how to prevent getting this infection? First thing is you have to cover your nose and mouth in almost all areas, except in your room. I am sitting in my room alone. It's okay, I don't need a mask. But if some people are around you, especially if it's not your household member, somebody else, better to wear a mask. So it need not be any very sophisticated mask, just little small cloth mask will be enough. You have to cover the nose and mouth so that the droplets coming from other people will not fall into in your mouth or face or eyes. It will not fall into your eye. And you should also do frequent hand washing so that if some of the droplets fall into your hand, that hand can accidentally go into the face and you may get the infection. So you have to do a frequent hand washing also. And if you have fever or cough or some symptoms like that, you may be COVID, may not be COVID, we don't know. But we should not give that infection to your near and dear ones or your friends or your colleagues. So that for that you have to wear again a mask. For that, it's better to have a 3-layer surgical mask or even a better mask like the N95 mask, which usually prevents your secretions, your droplets going out to the surroundings and infecting others. Again, same time, you have to wash your hands because very often your hands will go to your face, and from that the virus may be there in your hand. So if you give a handshake or you touch the TV remote, and your wife or your child touch the TV remote, again you may get transmitted. So again, frequent hand washing is needed, especially after touching your face or nose. This is how we can prevent this. That's usually we call it break the chain. So everybody is asking how this will end. How will this COVID-19 and will there be a vaccine or should everybody get infected and only then it will end. What I can say is chances of vaccine coming up in the next few months is very less. But by say end of the year, you can get a vaccine, but it should be available to all, and almost all should get vaccinated. Then only at least 60-70% of the world population should get vaccinated. Then this will end. Otherwise, the second scenario is everybody getting infected, around 60-70% of people getting infected. Then also this will end. But there will be a huge toll, because when there will be about 5%, around 1% death, enough. Just when 1% death means it will be a big toll. Maybe more than few crores of people will die. So these are the possibilities how this will end. So we have to break the chain by taking precautions, and this lockdown will also help so that the person-to-person interactions will be very less, so that the number of cases coming and overwhelming the system will be very less. What we are trying is reduce the number of cases coming, so that we can give the patients enough treatment so that they won't overwhelm the system. One more point I will add: those who are more likely to have very bad outcome in COVID-19 is those who are having comorbidities. Comorbidities means especially hypertension, diabetes, heart disease, kidney disease. Patient is having chemotherapy due to cancer, having severe respiratory problems like severe asthma or chronic obstructive pulmonary disease, smokers, also chronic liver disease. All these people have increased risk of getting admitted, increased risk of needing mechanical ventilation, increased risk of death. So all these people will ideally should practice something called a reverse quarantine. That is, young people who are not very, who do not have any comorbidities, can go out and work when the lockdown is lifted. But the other people, old people, especially above 60 or 70 years with all these illnesses, they should not go out as far as possible. They should not go out, especially in the public places where you are getting contact with a lot of other people. Better not to go out for at least maybe for a few months or even up to 1 year. This is a small update about COVID-19. I think if you have any questions regarding this, you can use this. You can comment under this video. I once again say goodbye to all. I am Dr. Arun from Palaghat, giving a small update of COVID-19. Goodbye.